I'm very excited to be here today. Cami Wolf-Rice with CWC, and this is our partner, Dr. Schenker, who is an orthopedic trauma surgeon at Grady Hospital. And Grady is one of the top 3 or 4 trauma hospitals in the country, right?
Something like that.
Yeah.
We are the busiest hospital in the state of Georgia.
Wow. Can you give me just a little bit of background about you before we get started in the actual deep conversation?
Sure. So I am a trauma surgeon at Grady. I've been at Grady for 5 years at this point. I grew up in Pittsburgh, Pennsylvania, and I've trained sort of all over the country. Did medical school in Chicago. I did my residency in Philadelphia at Penn, and then my fellowship at the University of Washington Harborview Medical Center in Seattle, Washington. And I've been at Grady now for 5 years.
And you could have gone anywhere. I know this because I know all your accreditations. And you picked Grady. And why Grady?
Grady, from a trauma perspective, offers a huge opportunity to help people. Some of the other jobs that I looked at, people come in with isolated fractures from ski accidents, for example, and that's a one and done, solve the problem, they go on back to their skiing lives. Whereas Grady, the patients that we see are very complicated, and I enjoy trying to help the whole complicated situation, whether it be they have a whole bunch of injuries, or they have medical problems, or they have substance use history, or they have mental health issues. To me, that's how I felt like I could make the biggest impact on the world, was to help people with multiple issues. And that is what's exciting to me about Grady, is we have a whole variety of patients.
So I have to tell a little bit of a story about how we met, because I was at Grady and you were having, actually, I think it was an internal meeting, and I got an invitation to participate. So, but I was just so impressed by your authenticity of you being on stage and saying, I didn't think I had anything to do with this opiate epidemic. Share a little bit about that presentation, and then you can tell everyone how I stopped you after you were finished.
Right. So I was just talking to my partners about this in advance of the talk, and I gave a talk just about the history of the opioid epidemic, because I'd been reading some of the lay press Dreamland book that had been written by Sam Quinones. I thought that was interesting, so I started talking to some of my partners, and I said, hey, what do you guys do after trauma? And it really shouldn't be an individualized thing. And I said to them, what do you give when they come back for their first post-operative visit? And at that point, I would have been the first to say I probably give the least amount of opioid pain medication when they come back. Then I found out of the 4 of us who worked there at the time, I probably gave the most. And the fact that reoriented my mind to say, hey, I clearly have no idea what the scope of the amount of pain medication that we're putting out into the world, and could we do better? We certainly need to make protocols, because the patients are the same. It just depends on whether they came in on my day or whether they came in on one of my partner's days. And so if the surgery they're getting is the same, and then the post-operative procedure that they're getting should be the same. And as part of that process of getting people back to well, in addition to the surgery that we're providing, they need to get off of the pain medications and move on with their lives so they can get back to normal, before, like they were before their trauma.